Shri Gurubhyo Namaha. Welcome to the Tadvidya Sambhasha Parishat series of Charaka Samhita Sutra Sthana. Today we are going to learn about the Kiyanta Shiraseeya Adhyaya. We are continuing with the Kiyanta Shiraseeya Adhyaya, third part. We can see that here in the Kiyanta Shiraseeya Adhyaya, mainly we are dealing with the dosha gati and also a type of dosha avastha wherein it is undergoing the kshaya avastha. The vatadi doshas as well as the dhatus and the malayanas and the other malas we are considering under the kshaya. So let us continue with the 63rd shloka wherein we have seen that vatadinam rasadinam malanam ojasastatha kshayas tatra aniladinam uktam sankshina lakshanam. So sankshina lakshanam, kshaya lakshanas of vatadi dhatus and also the other rasadi dhatus, then malayanas, everything will be considered here. So mainly the rasadi dhatus, if it undergoes kshaya, then it will have effect on the sharira. That is, we have seen in the earlier shloka that doshaha pravruddhaha swamlingam darshayati yathabalam kshinaha jahati swamlingam samaha swam karma kurvate. That is, if the kshina doshas are present, then they will leave their prakrita karma. Only that is seen. But we do not find any disease as such or any lacuna which is affecting the routine activity of the person. But if you consider the rasadi dhatu kshaya, then it affects in a very important way. So therefore you can see that in the 64th shloka, from the 64th shloka to the 72nd shloka, you have the kshaya lakshanas explained very beautifully. Gattate sahate shabdam nochair dravati shulyate hridayam tamyati swalpa cheshta asyapi rasakshay. In the rasakshay you have these particular features wherein gattate sahate shabdam now uchchair dravati shulyate. That is, the person will not be able to tolerate any kind of loud noises. This is usually seen in rasakshaya. In many conditions this will be seen. Hridayam tamyati swalpa cheshtasyapi rasakshaya. That is, hridaya tamyati means the person will feel like that something is happening in his heart or the chest. This kind of feeling will be there, anxious feeling will be there, even with a little bit of work or any kind of cheshta. Even if he walks, runs for a little period of time, or any physical activity or even mental activity will exert him. Then next you can see that parusha sputitamlana tvakruksha rakta sankshaya mamsakshaye visheshena spigriva udara shushkata. So in the raktakshaya you can see that the sputhata, that is sputita anga can be seen. Mlana tvagruksha, that is tvacha will become ruksha because of the raktakshaya. In mamsakshaya you can see visheshena, specifically spigriva udara shushkata. The wherever the dependent parts of the body are there, wherein musculature is more, there you can see that there is shushkata. Sandhinam sputanam glanir akshnor ayasa ivacha. So sandhinam sputanam glanir akshnoho ayasa ivacha. Here you can see that sandhi sputana will be there. That is, there will be a particular kind of pain or sputana, bheda kind of pain in the sandhis, in the joints. Glanihi akshnor ayasa. That is, the indriya dorbalya can be seen. There is tiredness of the eyes or any kind of indriyas. Then lakshanam medasi kshine tanutvam cha udarasya cha. So these are seen when the meda is depleted in the sharira. There is kshaya of medas. Tanutvam cha udarasya cha. You can see that the udara tanutva will be staying. Usually the udara is the part which is susceptible for accumulation of fat. Therefore in the abdominal part there will be less fat deposition, or the deposition of the fat will be weaning away. Then kesha loma nakha smashru dvija prapatanam shramaha gneyam astikshaye lingam sandhi shaitilyam evacha. So in the astikshaya you can see that these features are there. Kesha loma nakha smashru dvija prapatanam shramaha. Many times you can see that indirectly people come with hair fall. That hair fall may be because of the astikshaya, because kesha is the mala of the asti dhatu. Therefore many times we see that kesha loma nakha sparshu dvija prapatanam shramaha. Shrama will be there along with this patana of kesha loma nakha smashru etc. Gneyam astikshaya lingam sandhi shaitilyam evacha. Sandhi shitilata will be seen. There is looseness of the joints. That will be specifically seen here. Then Shiryate iva cha asthini durbalani laghuni cha pratatam vata rogini kshine majjani dehinam. So Shiryanta iva cha asthini. The person will feel that the asthi is hollow. That sushirnata will be usually seen. Then you can see that pratatam vata rogini means repeatedly the person will be affected with vata roga. Kshine majjani dehinam. In the majja kshina, the kshina avastha, these will be seen. Durbalani lakunicha. The person will become lagu and durbala also. The bala will reduce. Because majja is a dhatu which gives a lot of strength to the sharira, especially to the asti. So if that is lost, the bala also will come down. Daurbalyam mukashoshascha pandutvam sadanam brahmaha Shramaha Klaibyam Shukra Visargascha Kshina Shukrasya Lakshanam. So if Kshinata in the Shukra is seen, see here many times you can see that Daurbalyam Mukashoshacha. Durbalata will be seen, Mukashosha may be seen, Pandutvam Sadanam Shramaha. That is the loss of nutrition will be seen because Shukra is the Charama Dhatu, which also is responsible for the nourishment. Sadanam, that is a kind of body ache, and Shramaha, that is there will be tiredness. Klaibyam, that is the klibata will be seen, that is infertility on a long run. Shukra avisarga, that is ejaculation will not be happening properly. Kshina shukrasya lakshanam. These are the lakshanas of Shukra Kshaya. Then you can see that Kshine Kshakruti cha antrani pidin niva marutaha rukshasya unnamayan kukshi tiryak urdhvam cha gacchati. So you can see that there will be, if there is purisha kshaya, then there is a shakrat, if it is reducing, cha antrani pidyan niva marutaha, there the vata vriddhi may be seen, and because of that there will be pidana. Rukshasya unnamayan kukshim, there is the rukshata also will be seen, and the unnamana of the kukshi will be seen. Then tirya urdhvam cha gacchati. Therefore the vata vriddhi will happen, and there will be urdhvagati or the tiryak gati seen. Tiryak gati means sideways or all over. Mutra kshay mutra krisham mutra vaivarnyamev cha pipasa bhadate chasya mukham cha parishushati. Mutra kshay, in the mutra kshaya avastha, you can see that mutra krisham, there will be difficulty in passing urine. Then mutra vaivarnyamev cha, there will be vivarnata in the mutra. That is, the prakrita varna of the mutra is not seen. It can be reddish or pale yellow or completely dark yellow. This kind of vaivarnata will be seen. Pipasa badate chasya mukham parishushati. The person will be affected with lot of thirst. Mukham cha parishushati. There will be mukha shushkata, dryness in the mouth. Malayanani cha anyani shunyani cha lakuni cha vishushkani cha lakshante itasvam mala sankshaye. So the Malayanani, that is Malayanana here refers to all the malas. The other 5 malas also has to be, that is Indriya malas also have to be considered here. There is Indriya Adhishthanas, wherever they are. There is Akshi mala, Karna mala, Nasa mala, Jihva mala, all these things have to be considered. So considering all these things, there will be another 5 Malayana, that is Malayanas, that is 5 Malayanas along with Mutra and Purisha. So there will be 7 Malayanas totally. So therefore the kshaya of all these things will be resulting in shunyani cha laghuni cha. There will be shunyata and there is laguta, that is there will be no mala present in those particular regions. Therefore there will be shunyata there. So here you can see that the mala sankshaya will lead to the lagutva and also shunyatva. Therefore because of the mala sankshaya there can be vata vriddhi. This is the complication or the after effect or udarka which is usually seen. So therefore 18 types of kshaya have been described, starting from the rasakshaya up to the malayana kshaya. So how 18, that is 7, there is 3 vata pitta kapha kshaya, we know that vata kshaya, pitta kshaya and sleshma kshaya. Then we have the 7 types of dhatu kshaya, there is rasa to up to shukra, so 10. Then we have the malayanani, that is the 5 panchindriya mala. Then we have the ojakshaya also, which will be dealing next, and then we have the mutra and purisha too. So therefore totally 18 kinds of kshaya have been described here. So if you consider the ojakshaya, that is which is most important. In 73rd shloka, Viveti Durbalo Vikshnam Dhyayati Vyatitendriyaha Dushchayo Durmana Ruksha Kshamashchaiva Ojasakshaye. So Bibheti Durbalo Abhikshnam Dhyayati Vyatitendriyaha. That is, you can see that Bibheti Durbalo Abhikshnam, that is, the person will be having symptoms like fear, etc. Abhikshnam, immediately, suddenly these things will happen, or the person may go to the stage wherein the indriyas may not be working in a proper way. Dushchayo Durmana Rukshaha, that is Dushchaya, that person's aura will be lost, and Durmana, he will not be able to concentrate on anything, or he cannot apply his mind in many of the things. Rukshaha Kshamascha eva ojasakshaye. Kshama also will be seen. Kshama means there will be reduced nutrition. This will be seen. Because after the nourishment of all the dhatus, the ojas is nourished. That is how the nourishment happens, that we have already come across in the first year. So, this particular condition wherein oja kshaya represents that there can be other dhatu kshaya also. Because of the dhatus kshaya itself, the oja kshaya also will be specifically seen here. Then there are certain features. Hridi tishtati yat shuddham raktam ishat sapitakam oja sharire sankyatam tannasha vinashyati. So now this about this ojas, nowhere there was elaborate discussion. Therefore, this has been described here. Ojas has been described, that what is this ojas. Therefore, it is the sthana of the ojas and the karma of ojas have been described here itself. Hridi tishtati yat shuddham. What is this ojas? One which resides in the hridaya. Yat shuddham, it is shuddha. Raktam ishat sapitakam, it is a slight reddish, and ishat sapitakam, that is, it is a slight yellowish also in color. Ojah sharire sankyatam tannashanna vinashyati, that is tannashanna vinashyati, that is na means nara. So if the ojas is undergoing kshaya, then the person also will undergo a lot of kshaya and he may lose his life. That is what is told. Pratamam jayate hi oja sharire asmin sharirinam sarpir varnam madhurasam laja gandim prajayate. So the characteristic features of the ojas have been described here. And you can see Pratamam jayate hi ojaha sharire asmin sharirinam. So this is one of the most important nourishing factors for the person or the sharira. Sarpir varna, it is sarpir varna, it is told. Then madhurasam, sarpir varna means color resembling ghee, and madhurasam, the rasa is madhura. Then laja gandhi, that is the gandha, that is the odor of it will be similar to laja gandhi prajayate. Then brahmaraihi phalapushpebhyo yata samhriyate madhu tadvad ojaha swakarmabhyo gunaihi samhriyate radam. So here you can see that brahmaraihi, as these brahmara, that is honeybees, collect nectar from different phala and pushpa, that is flowers and fruits. In similar way, the ojas is also collected from all the dhatus and it is present in the hridaya. So there are certain kshaya hetus which have been described further in the subsequent shlokas, which are general hetus for kshaya. That is, in general, what are the nidana or the karana for kshaya, that has been described. Now in Roga Chatushka, why this has been described is because you can see that the first chapter of the Roga Chatushka is Kiyanta Shiraseeya Adhyaya, and it is important for us to understand what are the karanas for any kind of roga, that is any kind of vaishamya. It can be vruddhi or it can be kshaya. Therefore, the nidana or the karana for kshaya also have been described here. So in the 76th and 77th shloka, you get the samanya hetu or the nidana for the kshaya. Vyayamo anashanam chinta ruksha alpa pramitashanam vatatapo bhayam shoko rukshapanam prajagraha kafashonita shukranam malanam cha ativardhanam kalo bhuta upaghatascha gnatavyaha kshaya hetavaha. So these are the kshaya hetus or the nidanas for kshaya. What are they? Vyayamo anashanam, ati vyayama, that is excessive exercise, anashaman, not having food, chinta, having grief, or always thinking about something. Ruksha alpa pramitashanam, that is ashana, ahara which you are taking, if it is dry. Ruksha alpa, that is very less quantity, and pramitashanam, at each point of time, if the person has good hunger also, if he is taking very less amount of food, whatever is not sufficient for his Agni, then that is considered as Pramitashana. Vatatapo bhayam shoko, exposure to Vata or Atapa, that is sunlight, or fear, Shoka, sorrow, then Rukshapanam, that is having foods which are dry in nature, Prajagaraha, awakening at night. Kafashonita Shukrana Malanam cha Ativartanam, that is Kafa, Shukra, or Shonita, or any mala, if it is getting excreted out of the body in an excessive way, Ativartanam. Kalo Bhuta Upakatascha, that is due to the Kala also. Some Kalas are like that. That is the Avastha Kala we have to consider here. There is the Vyadhi Avasthas. In some Vyadhi Avasthas, the person will lose a lot of Sharira Bala or strength, or the Dhatu Kshaya also may happen. So that is considered here. Kalo here refers to the Avastika Kala. In Bhuta Upaghatascha, Bhuta Upaghata also may lead to the Kshaya, Gyantavya Kshaya Hetu. These are the Kshaya Hetus. After we consider the Kshaya, that is earlier we have already considered the Vruddhi as one of the Karanas for Roga. That is in the Hrid Roga or in Shiro Roga, we have seen that how Santarpana Jana Nidanas will lead to the Roga. Then we have seen that how Apatarpana, that is Kshaya Hetus, will lead to the Vaishamyata or Vishamata. Now we have two examples already taken into consideration. But we have another condition wherein we will be confused whether it is because of the Santarpana or Apatarpana. Sometimes because of the Santarpana there can be Kshaya, because of the Apatarpana can be Vruddhi in some parts of the body. This will be usually seen. And here the Samprapti involved usually will be the Avarana Samprapti. That is, whatever Nidana we see, it will not be in accordance with the Lakshanas whatever we see, right? We observe in the patient. So therefore such kind of example has been taken, that is especially the Madhumeha has been taken into consideration, wherein there is Avarana Janya Madhumeha. This is not the Madhumeha which is because of the Nidana Sevana leading to the Kapha Vriddhi, Kleda Vriddhi and all the other Dashadushya getting involved, and then first you have the manifestation of the Kafaja Prameha, then Pittaja Prameha and Vataja Prameha leading to Madhumeha at last. The 20 types of Prameha, it is not like that. It is directly how Madhumeha happens in a Sharira or in a person, or Samprapti of Madhumeha, how it is happening in the pattern of Avarana, that we are going to discuss here. Therefore, Avarana Lakshanas have been also described here in taking the example of Madhumeha. So, Guru Snigdha Amla Lavanani Atimatram Samashnatam Navamannam Chapanam Cha Nidram Asya Sukhani Cha Tyakta Vyayama Achintanam Samshodhanam Akurvatam Sleshma Pittam Cha Medascha Mamsam Cha Ati Pravardhate Tair Avrata Gatir Vayu Ojaha Adaya Gachati Yadabasti Tada Kruchu Madhumeha Pravartate. So here they are saying that the Nidanas have been explained in the 4 lines, the first 4 lines from the 78 to 79 shloka. Guru Snigdha Amla Lavana Atimatram Samashnatam. Samashana of all these things. Navamannam, that is new rice, if the person is taking all Santarpana Janya Ahara and also Vihara like Nidra, Asya, Sukha, etc. Santarpana Nidanas itself have been told. And also it is specifically seen that Tyakta Vyayama Chintanam, that is Achintanam, that is the person is not following any kind of exercise, he is not doing any exercise, not having any kind of chinta, and Samshodhanam Akurvatam, not undergoing any kind of Samshodhana, wherein it is definite that this dosha will get accumulated because of the Prakritataha also. In the Rutu also there will be dosha vriddhi. Sleshma Pittam Cha Medascha Mamsam Cha Ati Pravardate. So because of that, Sleshma, Pitta and along with the Meda and Mamsa will increase. Tair Avrata Gatihi Vayu Rojaha Adaya Gachati. So here what is happening is, there is Avarana of the Vayu. There is the Vata Vriddhi may happen because of the Avarana of Sleshma, Pitta, Meda and Mamsa. These 4 are increasing excessively in the Sharira, causing Avarana. So what will happen now? That the Vriddha Vata is taking out the Ojas. Ojaha Adaya Gachati, it is told. So this Ojas is being taken away and it is being carried to the Basti. Yada Bastim Tada Krucha Madhumeha Pravartate. So it is taking the oja to the basti and it is eliminating it out from the basti. So therefore in the mutra you can see that there is madhu gandha or madhu rasa. Therefore earlier shloka which was told that Sarpirvarnaha madhurasam lajagandhi prachayate, it is told. No? So the same lakshanas of oja will be seen in the meha, that is muhur pravritti of the mutra there. So here you can see that sa marutasya pittasya kafacya muhur darshayati akritim gatva kshayam apyayate punaha. So this will continue in the similar way because of the maruta, pitta and kapha, all the three doshas also get annulled. Upekshaya asya jayante pidakaha saptadarunaha. If you do the upeksha means if you neglect it. Upeksha is the opposite of apeksha, right? Apeksha is expectation, and upeksha is ignorance or ignoring something. So that is called as upeksha. If upeksha is done, if you are not going to take care of it, you are going to neglect it, then jayate pidakaha saptadarunaha, daruna pidaka will happen. That is, daruna means the ones which are very difficult to be cured. Such kind of pidakas are seen, and they are 7 in number. What are they? Mamsaleshu, avakashesu, manmasvapi cha sandishu. Where does it happen? It can happen in mamsaleshu, avakasheshu. That is, in the mamsa it can happen, or in the marma, or in the sandhi. Anywhere this can happen. So what are those? There are 7 types of prameha. Saptadarunaha they have told. So 7 types of prameha pidaka have been explained. What are they? Sharavika, Kachapika, Jalini, Sarshapi, Tatha, Alaji, Vineta, Akhyacha, Vidhradi, Cheti, Saptami. So there are 7 types of prameha pidakas which have been explained in this particular context. And the lakshanas of these 7 types of pidakas also have been explained. Among those, you can see that the last one, that is the Vidhradi. Vidhradi Cheti Saptami, it is told. So in the Vidhradi kind of prameha pitaka, you can see that there are different types. So here the definition of Vidhradi also has been given, because in the further shlokas also further management and in the importance of the Shastra Vidya for analyzing, diagnosing and also treating these kind of diseases, especially Vidhradi, it is important. Therefore Vidhradi has been given more importance here. So there are 2 types mainly which have been explained as Bahya and Abhyantara. Bahya Vidhradi and Abhyantara Vidhradi we have you can see that Vidhradi is a kind of disease which has got a lot of importance from the Shalya Tantra aspect also. So here you can see that the definition of Vidhradi has been told. Dushta raktati matratvat savai shigram vidahyati tatah shigra vidahitvat Vidhradi ityabhideyate. That is Dushta raktati matratvat. Here you can see that Dushta rakta ati matratvat. There is ati matratva of the Dushta rakta. So because of that there will be shigra vidaha. Shigram savai shigram vidahyate. Immediately there will be increase in the vidaha. Tatah shigra vidahitvat. Because in this condition we have increased vidaha, therefore it is called as Vidhradi. Vidhradi ityabhideyate. So there Vyadha Cheda Brahmanaha Shabdaspuranam Sarpinaha Vatiki Paitiki Trushna Daha Moha Madajuraihi Jumbo Utklesha Aruchi Stamba Shitakaihi Sleshmiki Viduhu Sarvasucha Mahachulam Vidhadishu Upachayate. So different lakshanas of Vidhradis have been told according to the predominance of the Vata, Pitta or Sleshma. All these things have been specifically told. Then you can see that Vidhradi Vimlatayata Vishchikairiva Dashyate Tanuruksharunam Shyavam Fenilam Vata Vidhradi. So here you can see in Vata Vidhradi Vimlatayata Vishchikaiva Dashyate. Vrishchika Dashana means the pain will be such that the person is bitten by a scorpion. Such kind of pain will be, that severity of pain has been explained here. So in such kind, especially in Vata Vidhradi, this is seen. Then Tilamasha Kulathodasanibham Pitta Vidhradi. That is the fluid which is collected in the Vidhradi, that will be like Kulathodasanibham. Kulatha Udakasanibham means Kulatta Kvata. So Kulatta Kvata will be brownish in color, right? So dark brown in color. Such kind of fluid will be seen when the Bheda of the Pittaja Vidridi is done. So that is the feature of Pitta Vidridi. Shleshmaki Sravati Shvetam Pichilam Bahalam Buhu Lakshanam Sarvam Mevaitan Bhajate Sannipatiki. So in Shleshmaja, you can see that Sravati Shvetam, there is Shveta Srava will be there. That is the fluid which oozes out when the Bheda is done, or when the Vidridi Bheda happens. It will be Pichila, there will be Srava of the Shveta Varna kind of Drava, and it will be Bahalam, that is thick, and also it will be excessive in the swelling will also be very large, but the pain may be less. In Vata there will be Atyanta Raja, Pitta there will be Daha more, and in the Shleshma there will be Srava, and the Shotha will be usually more. So therefore next they have described about the Sadhya Sadhyata of the Vidridi also. You can see that this Vidridi has been classified according to the Bahya and the Abhyantara based on the where it is going to lodge. It is called as Vastu. Vastu means where it gets particularly lodged. So here you can see that the Samuthana and the Sthana, that is Samuthana is the Nidana, how the Samprapti happens, and the Sthana is the where it exactly lodges. So here you can see that Vidridi is a disease which is occurring in any of the Avakasha, either in the Twak, Mamsa or Snayu, anywhere it can happen. So therefore they are considered to be coming under the Bahya Vidridi, that is which can happen in the Twacha, Snayu or in the Mamsa. The Abhyantara Vidridis, that is in the inside the Sharira, this may happen, like Hridaya, Basti, Nabi, Pliha, Kloma, Vrikka, Kukshi or Vankshana. Anywhere this can happen. So these are considered to be the Abhyantara Vidridis. The Abhyantara Vidridis are a little difficult to be cured, but of course there are it depends upon the severity of the disease also. So here you can see that if the Vidridi is affecting any kind of marma, that is Trimarma, that is Basti, Hridaya and Nabhi, if they are going to get Avrita, then it is a little difficult. And it is the Paripakva, that is completely Pakwa, and it is the Srava is more, or the severity is more, then it is quite difficult to cure. Then we have seen Lakshanam Sarvamete Tad Bhajate Sannipatiki. So in Sannipataja, kind of, that is all the doshas are involved, and the Vidridi has become very, very severe, then there it also, that condition is also very difficult to be cured. So that is called as Asadhyata of the Vidridi. There are different Upadravas also seen. Asan Hrinnabi Bastija Paripakwaha Sannipatiki Cha Maranaya, they have told. This Maranaya means they will be difficult to be cured, it will lead to Marana only. That is Hrinnabi Bastija, that is Hridaya Nabi and Basti, Paripakwaha, one which is Paripakwa and Sannipatika. Sheshaha Punaha Kushalam Ashu Pratikaranam Chikitsakam Asadhyopa Upashamyanti. So you can here see that Sheshaha, that is other types of, that is Ekadoshaja Vidridi or Bahya Vidridi, etc., or one which is not affecting the Marmasthana, especially Hridaya, Basti and Nabhi, those kind of Vidradis, if they are treated under the Kushalam Ashu Pratikaranam, that is Kushala Vaidya, if a skilled physician is going to handle this, and also if there is Shigra or the Ashu Pratikara, that is immediately if it is attended, then probably it will become Sadhya. Therefore, you can see that many kinds of treatments are usually done for Vidridi. Tasmad Achirotham Vidridim Shastra Sarpa Vidyud Agnitulyam Sneha Virechanair Ashu Eva Prakop Ashve Eva Upakramet Sarvasho Gulma Vacheti. So therefore you have to always treat like Shastra Sarpa Vidyut Agnitulyam, that is as there is Shigragatva, because it is told, no, the Vidridi itself, the definition of Vidridi itself is Shigra Vidahitvat Vidridi Ityavidiyate. There will be Shigrata there. Therefore it will spread as if like Shastra, Sarpa, Vidyut, Agni, etc. So therefore Sneha Virechanehi Eva Upakramet, that is Sneha Virechana should be done for that, because it is Pradhanataha Vidaha is there. Therefore, the Pitta will be more predominant. Therefore, Virechana, Sneha Virechana will be very much helpful here. Sarvasho Gulmavacheti. So, the line of treatment which is done for Vidhradi is usually Gulma Chikitsa. Gulma Chikitsa should be followed. Okay. So, one more important thing which is highlighted here is Vina Prameham Apyeta Jayante Dushtamedasah Tavat Chaita na Lakshante Yavad Vastu Parigraha Sharavika Kachapika Jalini Cheti Dusaha Jayante Tahi Atipala Prabhuta Sleshma Medasaha. Then Sarshapi Jalini Chaiva Vinita Vidrdi Chayaha Sadhyaha Pitolbana Tastu Sambhavati Alpamedasaha Marmasu Amse Gude Panyo Stane Sandhishu Padayoho Jayante Asipidakaha Sapramehi Najivati. So specifically the Sadhya Sadhyata for the Asadhya Lakshanas of the Vidrdi also have been explained here. It is told that Vina Prameha api eta Jayante Dushta Medasaha. Without the occurrence of Prameha also, because of the Dushta Medas, the Prameha Pidakas may happen. Many times this is seen. Tavat Chaita cha Lakshante Yavat Vastu Parigraha. Therefore, Vastu here refers to the Sthana. That also may be seen in many sthanas like Sharavika, Kachapika, Jalini, Cheti, Dusaha. All these things are there, but they are quite difficult to be cured. Jayantita Hiyati Balaha Prabhuta Sleshmamedasaha. Here you can see that it is predominant of Atibala Prabhuta Sleshmamedasaha. Prabhuta, that is excessive Meda and Sleshma will be involved in this particular Samprapti. And some are sadhya, that is like Sarshapi Jalini Chaiva Vinita Vidrdi Chayaha Sadhyaha Pitolbanastastu Sambhavati Alpa Medasaha. If the Medas is Alpa, that is the involvement of the Medas is Alpa and it is only Pitolbana, and it's diseases like that is types of Pidakas like Sarshapi Jalini, Vinita and Vidrdi, they are sadhya up to a certain extent. But if those Vidradis are or the conditions or the Pidakas are in the Marmasu Amse, if they are in Marma, or in the Amsa, Guda, Pani, Sthana, Sandhishu, Padayoho, or in the Sandhi or Pada, Jayante Yasipidakaha Sapramehi Jivati. That is, they are considered to be Asadhya Lakshanas. If the Sthana. So, therefore, this Yavat Vastu Parigraha, it is told. That is, where this particular Prameha Pidaka happens is more important for us. If it happens in these particular sthanas, then it is difficult to be cured. So, the other features also have been told. That is how these pidakas will be, if not treated or upeksha is done, then it may lead to upadravas also. You can see that the upadravas have been specifically told in the 111 shloka. Trit shvasa mamsa sankotha moha hikka madajvaraha visarpa marma sanrodaha pidakan upadravaha. So the upadravas of pidaka, that is upadrava means the complications which are aroused due to the neglecting or ignoring the features of prameha pidaka, that will lead to a lot of complications like this, like trishna, shvasa, mamsa sankotha, that is sankotha, that is there will be completely kotha, that is it will be like a wound, right? That will be seen, or petrification will be seen. Then moha hikka madajvaraha, there is severe conditions wherein the person's orientation also will be affected. Visarpa marma sambrodaha, it will spread. Then it may also affect the functions of the marma sthana. Pidakanam upadravaha. So these are the upadravas which will lead to the upadravas. These are the upadravas which are usually seen if the pidaka is not treated at the right time. There is specifically they have told that it should be kushala ashu pratikaranam. That is, by a skilled physician or skilled surgeon, it should be treated and it should be done immediately. Then only this will have a proper end. Then after considering all these conditions, wherein we have seen the example for the vriddhi or santarpana nidana leading to the rogas like Shiru Roga, Hridaya Roga, etc. Then we also have studied about the Kshaya. Then we have studied about the Avarana kind of Samprapti. An example for that, especially the Avarana Janya Madhumeha, we have come across. We have come across the with the Upadravas which can happen because of a disease. For that we have seen the the complications which are aroused due to the Avaranajanya Madhumeha, that is the Sharavika, Kachipika, Adi Prameha Pitakas, and also we have seen the Lakshana and Upadravas of these Pitakas. In special reference to Vidradi, we have seen all the types of Vidradi and also its Chikitsa. So all the examples of a roga have been already taken into consideration. There is Nija dosha involvement, Agantaja dosha in case of Krimija Hridroga and Krimija Shira roga. Then the types of the types of prameha which can happen, or types of roga which can happen either in the direct way or indirect way. There is Kshayajanya and also Avaranajanya we have seen, or Santarpajanya and Avarajanya. We have noticed the difference now. So further we have to once again know that what are the types in which the disease can get affected, or the dosha gati happens. Dosha gati means how doshas get changed themselves and how they are going to affect the sharira. That has been told. So doshas can have three kinds of avasthas. Kshayasthanam cha viddishcha doshanam trivida gatihi, it is told. Gatihi means here avastha has to be considered. So kshaya, it may undergo kshaya, it may be sthana, that is it may be in the stage of samatva, or there may be vriddhi of these doshas also. These are called as the trivida gatihi, that is three avasthas of dosha. Or it may also have another, if it is moving, then urdhvam cha adhishcha tiryaksha vignaya trivida para. Other kind of classification of dosha we can make, there is dosha gati, or when it is dushta, it may undergo urdhva gati, adha gati, or tiryak gati. There is the movement, linear movements. Urdhva, upper, downward, that is adha, and tiryak. There is linear movements also can happen. And if you consider the organs which it affects, or the roga marga which it specifically affects, then you can see that trivida cha apara koshta shaka marmasti sandeshu. It may the doshas may move from koshta to shaka, shaka to koshta, or it may also lodge itself in the marma asti sandhis. So that is abhyantara roga marga, madhyama roga marga, and the bahya roga marga. All the roga margas have been considered here. Ityukta vidibedena doshanam trivida gatihi. So in this way there are three types of gati of the dosha, three types or three classifications of the movement of the doshas, or the avasthas of the doshas have been considered. One, that is the kshayasthana and vriddhi. Second type, wherein you have three kinds of gati, when urdhva, adha and tiryak have been described. And then next one is the dosha gati from shaka, koshta and marmasti sandhi, that is the roga marga. So in these three ways the dosha gati will vary. And you can also see that the dosha gati happens with respect to the rutu also. Rutu prabhava also has a major effect in the gati of the doshas. So what are they? Chaya prakopa prashama. Sorry, there was some disturbance. So chaya prakopa prashamana pitadina mithakramam bhavati bhavatityekashah shatsuhu kaleshu. The chaya prakopa and prashama of the doshas happen in accordance with the rutu. That is, in the 6 rutus, it will happen in different ways. Gatihi kalakritaha chaisha chayadyaha punaruchyate. So chayadi, that is chaya prakopa and prashama of the doshas happen according to the rutu. That is, it is kalakrita. Then you can see that there are, if you deduce this Trivida Gati into two, then you have two kinds of Gati. That is, one which is Prakrita and another is Vaikrita. That is, which is leading to the Dushti, or which is leading to the Roga. See, Dosha Gati should happen always. That is, there should be a Prakrita Gati also. If there is no Gati of the Doshas, then it will lead to the Prana will not be having this Adhisthana in the Sharira, because there should be movement of the Doshas. So gatishcha dvidha drishtaha prakriti vikriti chaya. That is, prakrita gati of the doshas and vikrita gati of the doshas. Two have been considered here. Pitta deshu ushmanaha paktir naranam upajayate tacha pittam prakupitam vikaran kurute bahun prakritastu balam teshma vikrito mala uchyate sachaiva ojah smritaha kaye sacha papmopadishyate. So specifically they have told that this pitta, that is pittadeva ushmanaha paktir naranam upajayate. Pitta, the role of pitta, its importance in sustaining the sharira has been given importance here, because Pittadeva Ushmanaha Paktihi Naranam Upajayate. Pittadeva Ushmanaha. The Ushma in the Sharira is mainly maintained because of the Pitta only, and the Pakti, that is the Pachana, which happens, the transformation, all the transformations which happens in the Sharira is because of the Pitta only. Tacha Pittam Prakovitam Vikaram Kurate. If this Pitta is going to get vitiated in the Sharira, or if it is going to get Dushta, then it will lead to many diseases as such. Then if you consider the, of course, we are not considering the importance of Vata here, because in Vata Kalakali Adhyaya, in detail everything has been told about Vata. That is, what is the Prakrita and Vikrita karma of Vata, how it is responsible for the processes of the Sharira. The Loka Vayu and the Sharira Vayu karma has been explained. If it gets Prakupita, what happens also is told. But about Pitta and Sleshma it was not told. That is why it is specifically told here. So in Sleshma, coming to the topic of Sleshma, Prakritastu Balam Sleshma Vikruto Mala Uchyate, it is told. If the Sleshma is in Prakrita Avastha, then definitely it will be considered as Bala only. That is itself is Bala. That is why it is also called as Balasa. That is one which can provide Bala to the Sharira. So that if Prakritastu Balam Sleshma Vikruto Mala Uchyate. If it is Vikrita, then it will be considered as Vikrita. Sachaiva Ojaha Spritaha Kaye Sacha Papo Padishyate. So this itself, this Bala itself can be considered as the Ojas. So here you can see that there is an interlink. That is Prakritastu Balam Sleshma. The Prakrita Avastha of the Sleshma itself is considered as Bala, and Bala is nothing but the Ojas which is considered. That is one part of the Ojas. And if in Sharira this Ojas is not produced, or if this Prakritatva of the Sleshma is not maintained, then it is called as Papopadishyate. Papa means Mala. Once again it is considered as Mala. So if something is Prakrita, it is considered to be the dosha which is going to nourish the Sharira, or which will nourish the Ojas. Otherwise it is considered as Mala. Sarvahi cheshta vatena sa pranah praninam smritaha tenaiva roga jayante tena cha uparudhyante. So therefore once again, as Vata has to be given importance, once again it has been just quoted that Sarvahi cheshta vatena, all the cheshta, whatever it may be, even the cheshta with related to Kapha and Pitta also is related to, or it is controlled by the Vata. So therefore they are giving a statement that Sarvahi cheshta vatena, all the cheshtas, all the functions of the Sharira are because of the Vata only. Sa pranah praninam smritaha, it is considered to be the prana of all the prani. Tenaiva roga jayante tena cha uparudhyate. So because of this Vata only, all the rogas usually will occur whenever it gets vitiated. Uparudhyate, that is whenever it is Vikrita, in a Vikrita state, then that will lead to the diseases. That is what is specifically told. So what should be done? There should be a solution for all these things. The solution for that is the sutra or the Chikitsa Sutra in the Sankshipta form, which has been told here. There is 119 shloka, it has been told. Nityam sannihita mitram samiksha atmanam atmavan nityam yuktaha paricharet icchan ayur anitvaram. That is, if a person has the icha of anitvara ayu, that is shashvata ayu, or for a longer period of time he wants to live, there is dhirgan jivana. So what he should do, he should be nityam yuktaha, that is, he should be always endowed with these qualities, always. What are they? Nityam sannihita mitram, that is, always this the Sharira is affected by doshas, there is the vikritatva of the doshas. Therefore samiksham atmanam atmavan, that is, the person has to always see whatever is right for him, or whatever is congenial for him, whatever is good for him. Only Shubha karmas have to be taken up, and Ashubha karmas should be avoided completely. Then only the person will be able to avoid many of the diseases. That is, any kind of roga he can be devoid of. Otherwise he will be affected with a lot of diseases. So with this Chikitsa Sutra, in a very concise way, they have given the examples of all the kinds of sampraptis which can happen in the Sharira, which can lead to roga. That is why the first chapter of the Roga Chatushka of Chikitsa, that is Charaka Samhita Sutra Sthana, gives an example of all the kinds of sampraptis. So specifically you can see here that tatra shloka shirorogaha hridroga rogaha manavikalpajaha kshayaha sa pidakascha uktaha doshanam gatirevacha Kiyanta Shiraseeya asmin adhyaye tattvadarshina jnanartham vishajam chaiva prajanam cha hitaishina. So in this particular chapter, the different types of shiroroga, types of rudroga, roga, manavikalpajaha, that is how manavikalpaja means the dosha mana, that is kshaya, sthana and vriddhi we have seen. The combinations of the doshas also we have specifically seen here. Kshayaha sapidakascha uktaha, that is there are 18 types of kshaya. Then we have seen the pidaka, that is prameha pidaka, the 7 types of prameha pidaka, and also specifically the lakshanas of the vidridi also we have seen. Doshanam gatirevacha, how the dosha, trivida dosha gati also has been comprehensively understood here. And Kiyanta Shiraseeya Adhyaya tattvadarshinaha. So the everything, the concepts of roga, chatushka or roga has been systematically explained here. Jnanartham vishajam chaiva prajanam cha hitaishina. So jnanartham vishaja chaiva, this can be specifically understood by Bishak who wants to know about the roga, and also other people who can understand this for preventing the diseases. And this is compulsory to be, it is a mandate for the Bishak to understand this, because he has to always treat the patients in the perfect way, or they diagnose the diseases in a proper way and also treat them with the proper aushadha. So iti agnimesha krite tantre charaka prati samskrite shlokasthane Kiyanta Shiraseeyo nama saptadoshodhyayah. This we complete the 17th chapter. In the 18th chapter we have the now the sutrana, that is what all diseases can happen with the different sampraptis. So another kind of samprapti has been explained in the next chapter, that is in the Trishothiyam Adhyayam. So अतः त्रिशोथीयम् अध्यायं व्याख्यास्यामः इति हस्मः भगवान् आत्रेयः त्रयः शोता भवन्ति वातपित्तश्लेष्मनिमित्ताः ते पुनर्द्विधा निजागन्तुच भेदेन. So in the next class we will be discussing about the Trishothiyya Adhyaya, which is once again a samprapti which has to be very well understood and implemented, because this has a lot of application and implications in the further diseases to come, and also for the chikitsa this will be very very helpful to understand this particular samprapti. Okay, so if you have any doubts you can post it in the group. That's all for today. Thank you. Dhanyavada.